Well, the mandate is the headline. Today's Supreme Court decision also upheld the law's Medicaid expansion. The law expands Medicaid to about 17 million more Americans in 10 years. The issue was if the law infringed on states' rights and spending powers by attaching conditions to federal grants. The court's final say is that the law can withhold some, but not all, Medicaid funds if a state does not agree to expansion. So what does that mean? Good thing we have Dr. Donald Berwick, the former Medicare and Medicaid boss, with us today. Dr. Berwick, let me see if I get this straight. I know this is wheelhouse for you, so we're going to start here. So states can agree to expand their Medicaid coverage in order to receive federal funding. If they do accept federal funding, they have to adhere to the rules in the bill, and they can also refuse the funds now and the expansion, but they get to keep their existing Medicaid funding, right?
Yes, that's right. Under the Medicaid law of 1965, states could choose to be in Medicaid or not. All eventually chose to be in Medicaid, but they can set the eligibility limit as a percent of federal poverty limit. So one state could say you're eligible below 50% of the poverty line. Other states, 100% of the poverty line. There's a lot of variation, and the federal government shares in the cost, 50-50 or 60-40 or something like that, depending on the state. The new law equalizes eligibility. It says everybody will be eligible up to 133% of the poverty line, which is still pretty low income, but it says no matter what state you're in. But for the difference, let's say your state was covering up to 50% of the poverty line, the difference is 100% federal dollars for 3 years, and then it falls to 90% federal dollars, so it averages out to 95% of the money for the new people is federal. For the old people, it's a lower proportion. What the court said is the state can stay out of that expansion. They can keep their Medicaid program and not participate in the expansion if they choose to do that.
Well, let me follow up on that, Dr. Berwick, because it seems to me, there's been this movement, and we've seen it particularly since Obama became president, where you have states, particularly in the South, I think, where you have, Republican governors, Republican legislatures, and just generally speaking, very conservative states where they are moving as far and as fast away from the federal government as possible. Is there a scenario here where we basically almost have two Americas, sort of blue state America where there's broad Medicaid expansion as a result of this law, and red state America where there isn't?
I don't think that's likely. I mean, if you look at the logic of it, so let's say you're a state right now that's set its Medicaid coverage at 50% of the federal poverty limit. Now you've got an offer on the table. The federal government, 100% of the money supplied by the feds for 3 years and 95% to overall, you can expand. Well, if you choose to stay out of that, what happens? Those people, they're still living in your state. They're still poor. They're going to come to your emergency room. They're going to be operated on. They're going to have diseases that get worse, and you're going to pay for them. And that payment isn't going to come from the federal government. That'll come from the state, free care pools and charity in the state. I think what's going to happen is the states are now, all states are going to be under pressure from providers of care to saying, what are you doing? Why are you leaving this money on the table? Let's join with the federal dollars and get these people covered, because they're going to get care anyway, and you can care for them with state money, or you can care with them for federal money. And I think the states, one by one, are going to come in. It may take a little longer now that there's no loss of the rest of the Medicaid program, but I think the states are going to come to their senses, and they're going to be encouraged to do that by the providers.
Dr. Berwick, I want to shift gears real quick just for a minute. In an interview you did recently with The Guardian, you said the Republicans who opposed the bill, quote, and we can put this up on the screen, had concerns about rationing, about government takeover of medicine, about death panels, about the socialization of medicine, none of which were accurate and many of which were completely deceptive. But last week, a top doctor in the UK named Patrick Policino at the University of Kent told the Royal Society of Medicine that the country's National Health Service kills off 130,000 elderly patients a year. Isn't rationing inevitable when demand outpaces supply?
We have, in this country, we're spending more than double most other Western democracies. We have plenty of money in the healthcare system to give the care, all the care people want and need. We don't have to think about rationing. That's not on the table. And those accusations are ridiculous in the American context. And we're not talking here about a government takeover of care. I don't know where that idea ever came from. After the Affordable Care Act, we still have private delivery of care at doctors and hospitals. We still have a robust private insurance system. There's no takeover here. What we're doing as a country is saying that we have to put insurance companies companies on much better behavior so they don't take away your insurance when you get sick. We have to expand coverage into prevention. Private coverage has to cover prevention now because that makes a lot of sense. And if you're very, very poor and there's no one else to pay for you, yes, the federal government, we all together will make sure that you can get access to care. That's not rationing. That's the opposite of rationing.
Thank you, Dr. Berwick. I appreciate that comment very much. I think we have to keep in mind, guys, that illness and injury can happen to anybody at any time in their lives, and it is a major reason why people go bankrupt or lose a lot of their wealth or the money that they have. We have a safety net now that's going to keep people from just losing a ton of their income because they weren't able to plan for it with having proper health insurance. It's
How about their lives?
Important. Absolutely. Well, I mean, if you die, then you can't do anything about that. But I mean, like, people are losing significant amounts of the money that they have in the bank because they couldn't work for months, years, what have you, couldn't pay these massive hospital bills. We're not going to have that anymore. And that, in a country as rich as this, is an immoral and shameful thing.
Yeah, I agree with that. I mean, I see healthcare as a human right, and that is a debate that we sort of skirted actually during the healthcare reform. But, I was listening to Mitt Romney's statement today, and I was having a little bit of flashback to the healthcare debate when he was talking about the federal government coming between you and your healthcare and these, alleged $500 million cuts in Medicare and, all the old talking points coming back. I just hope that we aren't going back to that particular part of the debate.
I think Mitt Romney wants to move away from this debate as soon as possible, so
Absolutely.
I don't think you'll see him resurrect that. Yeah. All right, well, thanks, Dr. Donald Berwick, for joining us. We really appreciate it. Up next, what the decision means for the 2012 and presidential politics. We'll bring in NBC's senior political man, Mark Murray, as we do on The Cycle. Thank you.